Hi everyone, I'm Dhalia Masud and I'm a plastic and reconstructive surgeon. Today we're talking about breastfeeding and breast implants. A question you may not be thinking about now, but it may be something that pops up later on in life. We'll talk about the possibility of breastfeeding and how the changes in your body can be affected by the implant. Just as an aside, if you have any questions or further comments, let us know below and please subscribe for more information on plastic surgery procedures. So let's get to it. Maybe you had breast implants in your early 20s, or you're thinking about getting breast implants. Right now, starting a family isn't on your mind. You just want to enjoy life, and why not? But a few years down the line, when you do think about having children, you might wonder, will I be able to breastfeed with implants? Is it even safe for my body? Let's break it down. Implants are placed either underneath the muscle or above the muscle. Most of the time, the incision is made underneath the breast. This method avoids most of the milk-producing ducts, so lactation is more likely to be normal. If the incision is placed around the nipple, there's a higher chance of damaging the milk ducts, which could make breastfeeding a little bit trickier. In essence, the surgery can potentially make it more difficult for the baby to latch on. But here's the good news. Many women with breast implants can breastfeed successfully. I've had many patients with implants both above and below the muscle who have breastfed completely normally. Some couldn't breastfeed, but it's hard to know if the implants were the cause or if they would have struggled to breastfeed anyway. Is it safe? The next question is safety. Breast implants often contain silicone, and we know the silicone implants can leak or even rupture. So does that pass to the breast milk? The new implants are gummy bear type. So the effect is, even if there is a leak, it stays quite close and localized and it's less likely to spread. Research shows that the amount of silicone in cow's milk is actually about 9 times higher than human breast milk from someone with breast implants. So in other words, breastfeeding with implants is considered safe. So what can be the potential challenges and how can we overcome them? Now, some challenges can happen because of nerve damages. During surgery, it can reduce the nipple sensation, which may make it harder for the baby to latch on. Milk supply issues can occur, but starting breastfeeding early and feeding often can help stimulate the production. There's no strong evidence to show that implants drastically reduce your ability to breastfeed. But if you can breastfeed, it's generally considered safe. And like I've said, I've had many experience with implants and ladies who have breastfed, and it's possible. And those who weren't able to breastfeed, it's difficult to say whether they would have been able to breastfeed without the implants anyway. So how does pregnancy affect the implants? During pregnancy and breastfeeding, your breasts naturally enlarge as your milk glands grow. This stretches the skin and changes the overall shape. Your breasts will be larger. Your implants are durable. They'll keep their volume, but your body will change because the implants are measured to fit your pre-pregnancy body. You might notice a difference in the overall shape, slight asymmetry of the breasts also. Most of my patients actually enjoy the fuller look during pregnancy. After pregnancy, there are changes in your breast. Your milk supply drops and the breast tissue shrinks. For some women, especially those with more mature skin, the tissue doesn't snap back to its original position and the implants may sit in a relatively different position. Your implants will still be safe, but you might choose to make cosmetic adjustments later. There's no rush. If you're happy with how you look, you can leave things as they are for as long as you need. I hope this gives you a clearer picture of what to expect with breast implants, pregnancy, and breastfeeding. If you have questions or want to share your experience, drop a comment below. Don't forget to subscribe and we can keep this conversation going. I'll see you in the next one. Bye.